presentations. Next up is Jasmine, who is also doing her project broadly on religion and psychology. And in many ways, it is also relevant, albeit in a different way than Evans is. I mean, we are living in anxious times. We are anxious over finances, injustice, politics, economics, you name it, we are probably anxious over it. And here in the Bible Belt, at least, we are used to answering those anxieties with Jesus's peace that transcends all understanding. And of course, what that really means, it's my way of understanding what that peace is. If you disagree, there's a $60 King James Bible hanging up there. You know what Bible I'm talking about. So what is missing in this sort of line of thinking are religious voices from halfway across the world. And that's why I found Jasmine's thesis most interesting. I grew up in a predominantly Buddhist context. In fact, I'm engaged to a Buddhist. And to some extent, all of us who have Chinese ancestry have grown up with some form of Taoist ideals. And at the same time, Dogen Zenji's Kana Shobo Genzo and Lao Tzu's Dao De Jing are both in the honors first year curriculum. So in many ways, I was so interested in what Jasmine is doing in bringing those texts to bear on anxiety treatments. Now, it is not a conventional approach, but in some ways it fits Jasmine. Jasmine does not fit into a box. She always asks the hard questions that are not always evident, and her work always possesses an original creative dimension. And I really very much look forward to how this thesis is going to close out with a lot of interesting questions. So without any further ado, Jasmine.
Hey everybody, how are y'all doing? My name is Jasmine, as Dr. Ko said in his lovely introduction, and my thesis is titled Broadening the Anxious Mind, and it's all about why Eastern religions and ideologies like Buddhism, Taoism, and Zen Buddhism can help improve anxiety management, both in a therapy field and also in a personal atmosphere. So just to introduce the topic, the argument that I'm making in this thesis is that Eastern philosophy texts themselves may actually be beneficial to those with anxiety. And this is because anxiety in general is a fear-adjacent reaction, and it's usually in response to a stimuli creating some sort of irrational fear for that environment that the person is in. And this may cause controlling behavior. And Eastern philosophies mainly promote letting go of that control and being one with nature and the flow of life itself. To start off, I just wanted to give a brief overview of what anxiety is as a physiological response in the body. So you have, it's basically a fear that is seen as abnormal in the cultural context of the patient. And it is, again, usually in response to some sort of stimuli in the environment, and it mainly activates those 6 parts of the brain right there. Visual and auditory stimuli go through the thalamus to the amygdala, which is responsible for that fight or flight response. And after this, the amygdala starts to send a signal through neurotransmitters to the locus coeruleus, which starts those physical anxiety symptoms like the racing heart, or the shaking of the hands. And in terms of tactile stimuli or like sensation of smell, those actually go straight to the amygdala, where which means there's a higher memory activation in the hippocampus, which means that those are more likely to be remembered in terms of those responses. After the signals go to the amygdala then releases the neurotransmitters to either the proper place in the cortex, or it then gets recycled back into the amygdala to be reused again. And again, that goes to the hippocampus as well, because memory is very important in the formation of anxiety, because usually that anxiety can be brought on as because a certain sense will remind you of an experience that you had before. So this can lead to complicated expressions of the condition, which is then linked to both social and neurological factors. One thing that makes anxiety different than just regular fear is that it activates that bed nucleus of the stria terminals, often known as the BNST, which if you look on that diagram is that little blue sliver, which is right on top of that red circle, that's the amygdala. That's what's responsible for that sustained fear. So anxiety is something that can last for a really long time. There's also multiple types of anxiety. You have separation anxiety, selective mutism, and specific phobias. Selective mutism is one that probably isn't as familiar, which is consistent. It's a consistent failure to speak in social situations where it's expected, and it's usually you usually see it in children, but it can persist the older the patient is. There's social anxiety disorder. There's also panic disorder. And in the DSM-5, there's also a panic attack specifier, just as an explanation of what a panic attack looks like, because just because you have a panic attack one time does not mean that you have an anxiety disorder. But in a panic attack specifier, I just wanted to take the time to define this as well, just in case anybody ever needs to know, but it's an abrupt surge of intense fear or intense discomfort that reaches a peak within a few minutes, and it presents as at least 4 of like 13 symptoms, where you can have a really hard time breathing, you can have a really hard time focusing. The most common presentation of that is the media shows you like rocking back and forth on the floor in the bathroom, but some people also tend to shut down. There's brain fog, which makes people have an inability to think. Some people can't really speak to express what they're going through. So it's important to keep an eye out for those symptoms. There's also agoraphobia, which is it is a specific phobia, like I mentioned earlier, but because it has within that phobia, there's multiple different presenting points of that. It's worth mentioning on its own because people, especially after the pandemic of 2020, I feel like a lot of us had to go through an agoraphobic phase. Maybe not all of us had full-blown agoraphobia, but because we had a fear of going into these open spaces with crowds and getting sick or having something else happen, that we kind of got used to staying inside. There's also generalized anxiety disorder, which is the one that's most commonly talked about. There's also substance medication-induced anxiety disorder and anxiety disorder due to medical conditions, which as those sound, they're not anxiety caused by stimuli. It's, well, kind of. It's not caused by the perception of stimuli in the environment. It's caused by the stimuli of medication entering the body, or also the medical condition expressing itself within the body. And then there's also a final other or unspecified anxiety disorder. This is just for those that have anxiety symptoms that cause significant distress, but they don't meet any or all of the criteria to actually classify as having one of the other disorders. Some of the common treatments for anxiety are, there's cognitive behavioral therapy is the main one that I've talked about, and we're going to get to that in just a second. But anxiety affects about 18% of all adults and 25% of teens that are aged 13 to 18. The APA cites psychotherapy as the most helpful form of therapy, and this is probably what most people think about when they first think about therapy. But Sigmund Freud is the main guy who talks about that, and he kind of helped found that genre of research. But in terms of cognitive behavioral therapy, it's a combination of cognitive therapy, which is focused just on your thoughts, and it's based on the idea that negative thinking causes negative behaviors. So basically it's trying to control your thoughts so that you don't express any of those outwardly. There's also behavioral therapy, which is where you get to focus on things. I know y'all have heard of Pavlov with the dog and the bell. That's classical conditioning. And then we also have operant conditioning, which was Dr. E.L. Thorndike, which focuses more on punishments and reinforcements for behaviors. But cognitive behavioral therapy combines both of these, and it focuses on utilizing the ability to change the cognitive function of a person and utilizing that to change their behaviors in response to those thoughts. I personally felt like that wasn't very good, just because my experience having anxiety and also my experience talking to other people who have anxiety, we have a tendency to think a little bit too hard about things. So if you ask somebody with anxiety, why do I feel anxious? They could probably come up with about 50 reasons right then and there. If you give them long enough, they definitely could. But these Eastern philosophies have this concept of, again, letting go and not really trying to change things. Because like I mentioned before, anxiety is a physiological reaction in the body that doesn't always warrant a behavior in response. Because just because you feel anxious and you're in that fight or flight state doesn't mean that you're actually in a need to do something about it. Your life isn't always in danger, even though you feel like it is. So that's where, especially Buddhism, I feel like this was my entryway into this topic, but it's very concerned with the human situation and suffering. And there's the Four Noble Truths. The first noble truth says that the most prominent characteristic of humanity is actually suffering, because we refuse to acknowledge that there are things that we can't change, which is the second noble truth, which is saying that because we refuse to acknowledge that things are not permanent, that we continue to try to cling and grasp and obsess over things instead of just letting them run their course, is based off of ignorance, which then powers this cycle, which is called the samsara, which is powered by the popular expression of what most people would call karma. So it's powered by this cosmic chain of like cause and effect, because once you keep focusing on the things that you can't change, because it's futile to change it, you cause more frustration by trying to actually cling or grasp onto it. And then that brings us to the third noble truth, which is that just basically human beings have the capability to change the suffering, period. You're not stuck in it just because you feel like you are. What the people who succeed in bypassing this nature of suffering are those who have reached Buddhahood or nirvana, which is this stage of enlightenment where you're no longer tied to, not entirely physically, like obviously you're still in the physical world, but you're no longer tied to physical wants or needs as much as you have been before, which would allow you to sort of let go of that need to change things that can't be changed. And then that brings us to the fourth noble truth, which is, it's called the Eightfold Path, which is essentially the steps that you must take to get there. The first two steps are about right seeing and right knowing, which is all about becoming more self-aware and understanding the way that your body works, and that just because you have a thought or you have a desire doesn't mean that you have to do something about it. Then you have the next four steps have to deal with right action. So it's sort of the essential rules of Buddhism and the things that you must follow. Usually one of the main ones is that Buddhists do believe that everything is one. We're all like the same. I don't know if you've heard of the saying, we're all the same stardust. That's kind of a Buddhist statement. So a lot of Buddhists are actually vegan, and there's also requirements to take care of those who are in need and stuff like that. And then the last two chapters in those eight steps have to deal with, it's kind of like a preview of what will happen once you reach enlightenment. So it will be those, it's basically kind of explaining to you what enlightenment may feel like for you once you reach it. And there are two main schools of Buddhism. There's the Mahayana and the Hinayana. Mahayana is more loose. It doesn't follow it doesn't follow the strictness of some of the other Buddhist monks that preach. So it kind of allows you to focus on many aspects of Buddhism, and it can be more personalized to you. Whereas the Hinayana school is a lot more strict and has many more rules and follows the Pali Canon very, very to the letter. And then moving on a little bit more east to Taoism, which was founded in China, this is the concept of liberation from conventional rules and kind of like societal norms in a way. Taoists believe that there will always be limits to the human perception, which having taken a sensation and perception class this semester, I have found that to become even more true than I originally thought. But Taoists believe that there is no way that human conceptualization or language can possibly explain everything. So they instead took this, they still observe things, but they take everything that they observe with a grain of salt and kind of, they're more in tune with nature and letting things just be the way that they are without trying to categorize them or to explain them or put them in a box. And this has kind of created a fascination with nature itself to the point of almost a scientific attitude on nature, which is ironic considering their aversion to conceptualization. But this is also where the very popular concept of yin and yang came from, which goes a lot further than what you see in like, you know, the little gift shops and the spiritual gift shops with the good and the bad. But you have yin, which is the dark and receptive feminine energy of the universe. And then you have yang, which is a more masculine, strong, and more active measure of society. And instead of keeping these two separately, like how we tend to do in Western society, they actually, the whole purpose of yin and yang is to highlight the push and pull between them and how they interact with each other, and how you can't have things that are good without having things that are bad to acknowledge and to inform us of what good is. And Zen Buddhism, in my opinion, is a very good blend between the two, because it is actually created from historical contact between Taoist and Buddhist cultures, and also with Confucian ideals. And there's also a little bit, sprinkle of Indian mysticism in there as well, because of the combination of all of these philosophies and theories coming to head in Japan, which is where this was originated. And the thing about a Japanese way of life is that it's very practical, and they want you to be very mindful of everything that you're doing and being very in tune with you, the people around you, your environment. And so they have this concept known as Satori in Zen Buddhism, which is essentially Buddhist enlightenment, but in a different way. It's closer to the Mahayana method, where it's very loose, where you can kind of practice this in any way that resonates with you, but it allows for people to enjoy active participation in their day-to-day lives. And the Zen Buddhists believe that true enjoyment of life on earth isn't trying like what's going to happen in the afterlife, which a lot of religions or beliefs focus on. They actually focus instead of, they believe existence is just existence, living, that's the best part. And then I just wanted to do a brief benefits of each one. Buddhism, I believe that the multiple approaches of Mahayana school are very beneficial to anxiety, because there are less regulations and rituals, so there's less focus on, am I doing this the right way? Am I gonna mess it up? And am I not gonna reach enlightenment? Versus the Hinayana school, which could be good for those who need more discipline and structure, but it has that one way that you can do it, which is helpful, but can also be detrimental. Taoism is the one that I personally believe would be the most helpful, because it provides this this sense of letting things go and not actually trying to change things, so that it highly dissuades overthinking, And it kind of allows people to live a balanced life without having to change too much of their everyday life. And it, again, dissuades over controlling behavior, because if you're making an effort to not control or not to try to control the things around you, then you will be less likely to try to control your own emotions. And then Zen Buddhism is the one that I would say has been most recognized as beneficial, although there hasn't been a lot of research into why it's been beneficial. So that's where I'm filling the gap. But it's kind of, again, focusing on the beauty of life that we're already living. Most people have used this for treatment for depression, and that's what I'm going to bring up with Morita therapy right here. This was one of the main things that helped fuel my early research. This is Shomo Morita. He created a psychotherapeutic treatment that's designed to treat what he called Shinkishitsu, which is combination generalized anxiety and depression. It was essentially aimed to reorient people in nature and allow them to accept their emotions and themselves as they are. And it's designed to treat what he called the vicious cycle of Torawari and Hakurai, which is similar to the Buddhist first two noble truths, is the intense focus on mental health and the futile attempts to control or remove those. And this was a 4-step, highly unconventional program. It usually started with the patient having a week-long bed rest at his home, and then there would be 3 steps after that. The first step would be light, monotonous activities such as like light gardening, maybe some knitting or crocheting, things that are designed to hold somebody's attention and get them ready to do a more productive activities. The second step would be more purposeful activities like doing chores or doing laundry or cleaning and stuff like that, maybe some more intensive gardening, things that are actually going to be productive to the patient's life. And then the third step is kind of like the reintegration back into society. The therapist can then encourage the patient to maybe apply for a new job, talk to your manager about this, do certain things that would help them apply the things that they've learned about channeling their negative emotions into productive action. Another therapy that I learned about recently was acceptance and commitment therapy. This is extremely similar to Morita therapy, and both of them contain elements of Buddhism and Zen Buddhism, although neither of them actually credit Zen Buddhism or Buddhism. It's just something that I've noticed and drawn parallels to as I've done my research. My personal belief is that because in the science department, there isn't a lot of room to express religious beliefs without people thinking that you're straying away from the science, which is not true. But it's focused on accepting thoughts and feelings similar to Morita, but it also encourages folks to live in line, like take those acceptance of thoughts and feelings and use that to allow them to live in line with their core values. And they believe that the anxiety symptoms themselves are not problematic. It's the futile attempts to control and master it. And I just wanted my brief results that I found after all of my research is that I was correct in my assumptions about what those religions would help with. But I also found that when somebody is already religious, it has been found that incorporating religious elements into their therapy is actually more beneficial and helps them heal faster than if you were to just try to not incorporate that, maybe not touch on that. And that's why cultural competency is so important in therapy, because just incorporating a small part of a client's life can help you reach them that much better. But it also helps people recognize that when you start to obsess and scrutinize over things, it can actually be counterintuitive, which I feel like some people who have, again, bringing back to that cognitive behavioral therapy, sometimes overthinking and constantly trying to analyze your behavior can actually make things worse. And it'll make you more self-aware and more hypercritical. And these philosophies heavily rely on the importance of being able to let things go and accepting things as they are. It encourages mindful living and acceptance of all phases of life, both good and bad. That's where you get the cyclical nature of life that is found in Taoism and the the importance of accepting both good and bad that can be found in Zen Buddhism, just enjoying all aspects of life. And I also learning more about Morita and his therapy. He had this law of emotion that states that all emotions will naturally dissipate if you just leave them be and let them do their thing. And that's kind of shown in that diagram that I showed you earlier, because after that whole cycle is over, the brain has to go back to doing what it normally does. The more you focus on the actual feeling, the more you can actually sustain your awareness of that feeling, which will then keep that feeling present. And this is not to say that behaviors are not within our control, but emotions themselves don't always require a reaction. And finally, this is the most important to me. It encourages just a strong desire for living, and it provides important tools for people to cope with symptoms of anxiety that may never go away. Like Dr. Poe mentioned in his introduction to me, we live in a very anxious time. More people than you would guess deal with anxious thoughts or anxiety in general on a day-to-day basis. So because if we make this a little bit more of a mainstream treatment for anxiety, and even acknowledging that these are religious ideologies, this could help teach patients that there's nothing wrong with feeling their emotions. Even if that is anxiety, there's no inherent attachment of good or bad to any emotion. It's just an experience. But here are my sources. Any questions?
Okay, we have 10 minutes for questions.
So when you were talking about like acceptance and how important that could be, it reminds me of DBT, dialectical behavioral therapy. So I was wondering if you ran across it at all in your research, which maybe not because you're researching religions, but I do wonder how maybe a mix of like one of these and DBT could help effectively.
Yeah, I think that is my intention with this, is to get therapists to understand that they can combine these ideologies with their existing forms of therapy. And even with CBT, even though I've expressed my problems with it, everybody is different. And because there's such broad presentation of anxiety, there's so many different types that we went over, everybody could benefit from a different therapeutical blend.
This is maybe more a comment, but I've read that climate change anxiety has become more of a thing over the past decade, which is probably different, a little bit different than like how you presented anxiety when someone, it's more like personal issues. But it seems to me that using these Eastern religions, as you suggest, could be particularly effective for that type of anxiety. Maybe in some ways, and in others, like where was it Taoism or whatever, where it was like, well, has nature intended? And I can imagine someone who's suffering from climate change anxiety to be like, I didn't intend any of this, and just, but
yeah, you're absolutely right. That is sort of kind of what I was thinking about when I first started this thesis, is for those anxieties or those anxious thoughts that either can't go away or won't go away because of things that are out of our control. It's all about learning how to cope and almost get out of your own head a little bit when it comes to those things, because obviously acknowledging those things are still going to happen is important, and that doesn't mean we can't change it in the future. But in our current situation that we're in right now, the strategies that could come out of these philosophies could be really beneficial.
So in your research, did you find anything that supported prayer and worship to be mindfulness practices as well?
I wasn't looking as much into mindfulness practices just because that field has already been very studied, but definitely prayer is, I would consider, a form of mindfulness, because it's still taking time to reflect on your life and maybe things that you can change, maybe things that you can't change. Even if it's just asking for support, that's still practicing a form of being aware of what you're going through and what you may need.
Really interesting. I'm struck and have been struck by this for a long time, especially with Buddhism. How it's it represents a mental discipline, but also oftentimes, right, a behavioral discipline goes with it, right? And it seems to me, back to what you were saying, that's part of what makes it a fruitful sort of approach to anxiety problems and maybe other problems as well, right? But it also strikes me, and I'm not sure if you've got an answer for this, right? But I just want to throw it out there because it just seems really interesting that if you pursue the Eightfold Noble Path, right? Your goal isn't to overcome your anxiety. Right? Getting over your anxiety is a side benefit. Right?
Yeah.
You're after something else, right? But I wonder if that might also be an important part of whether we're talking about Buddhist practice or if you found practices that you weren't studying this, but if you looked at Christian monastic practices or things like that. If there's something important about that, pursuing the higher goal, whether we call it enlightenment, nirvana, oneness with God or whatever it is, if there's something about that is maybe an essential ingredient to actually overcoming anxiety.
Yeah, I think, like you said, it's again, like I brought up before too, the focus on the anxiety is sort of considered the problem in these philosophies or in these therapies created off of this philosophy. So I think that you're right, especially because you're pursuing something that you're not really you're not thinking about the anxiety or how it might affect you. And especially in Christianity, where there's this very present idea that God is sort of going to take care of everything, no matter what. And it might not look the way that you think it's going to look, but you still have the ability to know or have the confidence to know that everything is going to be okay. So you don't really have to worry as much. It allows you to focus more, again, on the actual practice or the actual discipline versus what you may perceive is wrong with you or with your life.
I think we have time for one question. No, great job, Jasmine.